So in this session, we'll do the quick review of temporal fossa. So temporal fossa is bounded superiorly and posteriorly by the temporal lines. There are two temporal lines, superior and inferior temporal lines. So inferiorly, there is zygomatic arch. So medial to the zygomatic arch, there will be communication between temporal fossa and infratemporal fossa. And below and behind, there will be supramastoid crust. I'll show you in the diagram. So anterior wall is formed by the temporal surface of zygomatic bone and greater wing of sphenoid. The floor, parts of four bones form the floor. The most important point will be the pterion. The frontal, parietal, temporal, and greater wing of sphenoid. All these four bones join in the form of H-shaped suture called the pterion. So there lies the sylvian point beneath the pterion, where the stem of the lateral sulcus or the sylvian sulcus divides into the anterior horizontal, anterior ascending, and posterior ramus, and middle meningeal vessels lie immediately beneath the pterion, wherein injury to the pterion results in damage to middle meningeal vessels, resulting in extradural hemorrhage. So laterally, temporal fascia. Inferiormedially, there is a communication between infratemporal fossa and temporal fossa between zygomatic arch and side of the skull. You can see here. So above and behind by the temporal lines, and below and behind you can see this is a supramastoid crust, and below and in front this is a zygomatic arch. So medial to zygomatic arch, there is a communication between the temporal fossa and infratemporal fossa indicated by the arrow. Anteriorly, the temporal surface of zygomatic bone and the greater wing of sphenoid. So this delineates the temporal fossa. So the contents will be temporalis muscle, temporal fascia, middle temporal artery, which is a branch of superficial temporal artery, zygomatico-temporal nerve and vessels, deep temporal nerve for temporalis, and deep temporal artery, which is a branch of maxillary artery, superficial temporal vessels, and auriculotemporal nerve. So superficial temporal artery in brief. So it is the smaller terminal branch of external carotid artery which arises within the substance of the parotid gland. Then it emerges from the superior surface of the parotid gland. The branches are as follows, namely the transverse facial artery, anterior auricular branch, zygomatico-orbital artery, middle temporal artery, and terminally divides into a frontal branch and a parietal branch, otherwise called anterior and posterior branches. So temporal fascia, there is a thick aponeurotic sheath which covers the roof of the temporal fossa. So attachment superiorly attached to the superior temporal line. So inferiorly splits into two layers which are attached to the inner and outer lips of the zygomatic arch, upper border of the zygomatic arch. So the gap between these two layers contains the loose irregular tissue, fat, branched from the superficial temporal artery and zygomatico-temporal nerve. So you can see here, this is the upper attachment of the temporal fascia to the superior temporal line. The lower attachment is split into two layers attached to the upper border of the zygomatic arch to the inner lip and outer lip. Here you can see this is the temporal fossa, and here you can see this is the infratemporal fossa. So this is the communication medial to the zygomatic arch. Between the zygomatic arch and the side of the skull, there is a communication between the temporal fossa and infratemporal fossa.